Hello and welcome to NAFDAC and your else. My name is Tosing Omolaja, and here's where we bring you up to date with NAFDAC's activities with regards to its mandate of safeguarding the health of the nation. Thanks for joining us for another insightful edition of the program. Today on the program, we'll explore NAFDAC's enforcement activities carried out across the country. One of the important aspects of keeping the nation free from expired and substandard products is regular checks on manufacturers, distributors, and retailers of products being consumed by the public. NAFDAC, as a regulatory agency in ensuring the health of the nation is safeguarded, engages in several enforcement activities to keep manufacturers and retailers on their toes in compliance to good practices.
The strength of a regulatory agency also lies in the enforcement. In fact, if there is no enforcement, there will not be a regulatory agency, because a regulatory agency is supposed to enforce or to control, of course, the regulatory activities and to ensure that people do not violate the regulations. Therefore, enforcement is extremely important in NAFDAC, but it is not just as part of our regular activities. The Federal Task Force C-34 law is domiciled in NAFDAC. The headquarters of the Federal Task Force is in NAFDAC. And it is supposed to, the Federal Task Force is supposed to control, to ensure there are no fake medicines in the country, no unwholesome foods in the country. And with that Federal Task Force headquarters in Lagos, you have 36 state task forces. So enforcement is so important for NAFDAC as a regulatory agency. But in terms of food, drugs, chemicals, and all the things, that it is extremely important for the country. That is part of the reason why it was domiciled. It has been domiciled in NAFDAC. People may not understand what NAFDAC is in terms of enforcement, but we are also policemen, looking out for violators to ensure there will be deterrent. They will not repeat whatever they did before. We have about 75, almost 80 policemen attached to NAFDAC because of this Federal Task Force that is domiciled in NAFDAC. And the enforcement can be as simple as somebody resisting NAFDAC to enter their property, and then enforcement will come in with police to ensure that whatever NAFDAC wanted to see, NAFDAC sees. It can be as simple as that. It can also be, or they can find themselves in a situation where they are keeping vigil at the ports, at the border, for days on end, through intelligence. When they've been briefed that there is contraband or violated products coming through a particular route, it can be to that point. It can be a raid where they have to go to the market or to a particular site where falsified medicines are being made or sold or whatever, or unwholesome food. It can be sealing a company, paying on unannounced visit to a company. Let's say that there is an issue of bad distribution of medicine coming from a particular company, like the codeine that happened, the codeine issue that came up May of 2018. Enforcement had to go unannounced to do inspection with drug evaluation and research directorate because they are the inspectorate, arm for drugs. So it is an activity that takes place almost every minute, depending on where informants or the information is coming from. Enforcement cannot happen just within NAFDAC. There is a lot of collaboration with customs, with EFCC, with World Customs Organization, with Interpol, with FBI, meaning it has now gotten across or gone across from our country to another country. So enforcement is extremely important.
NAFDAC, in persistence of our collaborative effort with sister agencies, carried out an enforcement operation in conjunction with the Pharmaceutical Council of Nigeria, PCN, in Lagos, to ensure adequate compliance to regulations by stakeholders in the pharmaceutical sector.
These are the products I talked about. Yeah, these are products.
Omeprazole.
Yeah, omeprazole. We have that cocaine, that corner product, we have our level industry, those two. Yes. We have plus zinc.
So you do distribution mainly? Are you to wholesale? Do you do any retailer? Product?
No, we sell, I say we have reps that meet with the wholesalers and hospitals.
So you are mainly distribution?
Yeah, just through the wholesalers and hospitals.
Okay, we want to have a list of products that are registered with DNC. And we'll see evidence of their registration.
Apart from this place, do you have another packing store?
Yes. It's off Additional Avenue.
Off where?
Off Additional Avenue.
Is it far from me?
Huh?
Is it far from me?
Yeah, it's not far.
What about within the facility?
No, this is what we have.
But your company is registered as a what? What is this place license?
Global Healthcare Limited.
License as a distributor. What is the category of a practice that you are
It's
registered?
an importer. Like I said, most of the products are from India.
Importer.
So, yeah, so we're from India. So we bring them in from India.
Sorry, can we see your license?
Premise.
Yes.
Well, I only see for last year. But this year is not yet out. I just processing it.
Yeah. But who is your pharmacist anyway?
I'm the pharmacist.
You are the pharmacist.
Yeah.
You are the pharmacist.
No. I'm not the pharmacist, but I'm the one in charge of supermarket.
But you,
It's not like but I'm the one in charge of supermarket.
so, but we can have a copy of your last year and certificate.
You mean for the company?
Yes,
Of course,
premises license.
Yes,
Like
yes.
beside.
Sorry. This for the king of the address to this is our that time when we approve where something.
So we just raised a concern now about your, because I asked initially, now what were you licensed for? Because I told that you bought pharmaceuticals. And we have seen the evidence. But getting here now, I think something that is very close to even retail or wholesale distribution.
No, we don't do retail.
Don't do
We
retail.
do distribution.
By this setup, what does it? It's talking about service drug now. I want to know how this one justify the essence of getting the permit for having service drug.
It's for service drugs or not. You're a pharmacist.
Yes.
You are licensed. You can do whatever you want, but you must do it properly.
Properly
Okay.
and respect
You are
the.
licensed for importation. This what we are saying here is not importation.
Exactly.
This is not importation, and these drugs I beg to I beg you to disagree. I don't think they are imported directly by you. Those are your drugs. Those are your line.
Okay.
This looks more like you pull drugs from different places and you are filling up orders. This is a
We are going to get to them because you are an importer
we
now.
bring them too.
There must be
We
evidence
bring-
evidence of importation.
That's what I'm saying, that we have the service drug list.
We have to confirm the service drug status of our office. But pending the time, we are going to pay the piece of till when we confirm the list that was approved for you by NAFDAC, then come and cross-check what we have here and see how much of compliance we have. We are going to log this place.
Okay.
Then collect the papers and we'll get back to when we confirm what we need to confirm from the authority that normally issue the service drug. So we do that, but we need samples of some of these products to go with us.
We'll take a short break now. Don't go away.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family, and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your rails.
We are actually spot checking on our stakeholder in the distribution outlets. And as I said, we are working with a sister agency with the Pharmacists Council of Nigeria. So we are checking the premises for the status of the premises as concerned the Pharmacists Council's mandate. And we are looking at the product itself, the status of the product. Are they registered? Are they stored in the proper recommended storage condition? Have they expired? So those are the things we are checking to make sure that the operators are actually working in line with what is expected of them in making sure that the products are kept in adequate storage condition for effective, for therapeutic efficacy that is expected of the product. Most of the time, the challenges are about the terrain, the location, the accessibility, and the environmental issue. But by and large, we are able to surmount it, and we are getting adequate cooperation from the stakeholder. Though it's more challenging in terms of the manpower and the logistics, but we are getting ahead. There's no resistance anyway, because as far as NAFDAC is concerned, we are at liberty, we are backed by law to go to any premises at a reasonable period of time and to see exactly what is being done. That's exactly what we are doing here, and we saw a few products that are actually not registered, and that is the concern of the agency, because products that are not registered are difficult to trace if there's any issue in the healthcare delivery system. So these are the challenges that we are trying to get the stakeholder to come on board with us to make sure that we get the society rid of unregistered products, because they present danger to the end user, who are the patient or customer to their care. So it's an ongoing engagement and appeal and education to let them see the reason why products that don't carry NAFDAC number should not be stocked. Products are not stored according to the recommended storage condition. They cannot be expected to be as effective as they should be. So actually, it's a kind of endangering the life of people that use it, because if a product is refrigerated maybe at 2 to 8 degrees and is left on the shelf at 25 degrees Celsius, definitely you know that even if the product has not even expired, if you use it, if a customer use it or a patient use it, you cannot get 100% effectiveness as required by the law. So those are the challenges that we have, and we are trying to educate them, but we don't spare anyone that fall below the expectation, because there are penalties for those activities.
The Assistant Director, Inspection and Monitoring Department, PCN, explains the importance of the collaboration.
It's a joint monitoring exercise between the Federal Task Force, NAFDAC, and the Pharmacists Council of Nigeria to ensure total compliance with the regulations. On our own part, we want to ensure that all premises that drugs, medicines are sold are being licensed, and that is why we are here. And then the products are also stored in a good storage condition. The NAFDAC may not know all the premises that are licensed. Meanwhile, PCN have the record of licensed premises. The joint operation today is to ensure that things work better and to make sure that the level of compliance by stakeholders is of higher level.
Time now for NAFDAC update.
Drug counterfeiter bags 7 years in prison. The National Agency for Food and Drug Administration and Control, NAFDAC, has received a boost in its fight against falsified and substandard medicines when the Federal High Court in Awka, Anambra State, sentenced a middle-aged man, Ogbodo Friday, to 7 years imprisonment without an option of fine for endangering lives of innocent consumers through circulation of fake drugs. Ogbodo, who was arrested by the Investigation and Enforcement Officers of NAFDAC at his residence in Onitsha, was arraigned at the Federal High Court, Awka, Anambra State, on a 2-count charge bordering on possession of fake Maldox and packaging of Emzor paracetamol in a manner that is misleading. The court convicted the defendant and sentenced him to 5 years in prison on count 1 and 2 years in prison on count 2 without an option of fine. The Director General of NAFDAC, Professor Mojisola Adeyeye, in profound elation, commended the judiciary for rising to the occasion when it was needed. She said the agency will not rest on its oars until all still in the dangerous business of falsifying medicines to make money at the expense of the lives of fellow Nigerians are brought to justice, or they abandon the trade for clean jobs. NAFDAC trains staff on fire safety. NAFDAC continues to improve the capacity of its workforce through trainings, staff safety, and welfare development. Recently, the agency, in conjunction with the Federal Fire Service, organized a fire safety program to educate staff of the agency on measures to take in case of incidents relating to fire. The fire safety program was facilitated by officers of the Federal Fire Service with extensive discussion on areas relating to NAFDAC framework.
How many of us that also spare time that after the closing of work, before you go, 2 to 3 minutes, look around the office, put off all the electrical switches that you have before you go. We've had fire occurrences that it was after the closing of work, there was a fire outbreak on account of somebody left electrical something not putting off.
That's it on NAFDAC Update. You've been updated.
That's our package for today. Please join us again, same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers in your area, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Remember, COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.